So I was working in the residence clinic, actually the student's clinic at my medical school, with a 44-year-old woman who had complained of sciatica. And this was a chronic problem for her. And indeed, she had a straight leg raise sign. And this was causing her big problems. So I went into the room with the students and I did my full exam. To keep the story short, we had her sit upright on the table. And if you think about it, that's actually doing a double straight leg raise to 90 degrees, and she was okay with that. So I was trying to justify what was going on. She had the positive straight leg raise at about 30 degrees, but again, when she came up to upright, she didn't experience pain during that maneuver, perhaps because she was distracted. And I really didn't think that she was drug seeking, and so I had to come up with an alternative that perhaps she had other pains that were contributing to this sciatic pain. When I asked her about a history of trauma, she disclosed that she had been abused as a child. And one of the things that I've learned to say in my old age to people with irritable bowel syndrome or fibromyalgia, many of whom have a history of abuse, I say, I can keep treating this medically, but I really think the emotional pain that you have that's not been dealt with is making this other part of the pain worse, and I won't get an optimal result until you start working on this other part by counseling or other methods, and you don't have to do that. And so I've run into many patients since then that I explain some of this is probably made worse by the emotional pain that you're having. These patients have usually seen the doctor multiple times. I know we all have patients like this. It usually results in frustration and accusation of drug seeking or that they're nuts. And in reality, it's just a different kind of pain that needs to be addressed that's making the pain we know about worse.